Did you know that taking the wrong combination of drugs could be fatal? Imagine taking two common medicines, only to realize they're working against each other or even making your condition worse. In this video, we'll discuss the top 10 most important drug interactions every pharmacist, doctor, and patient should know. Stay till the end. These interactions can save lives. Before we dive into specific drug interactions, let's understand their types. Drug interactions are mainly categorized into three types. First, pharmacokinetic interactions. When drugs affect each other's absorption, distribution, metabolism, or excretion. Second, pharmacodynamic interactions. When drugs interact at their site of action, leading to increased or decreased effects. Third, pharmaceutical interactions. When drugs react before they even enter the body, such as incompatibilities in IV solutions. Today, we'll focus on pharmacodynamic interactions, where drugs directly enhance or inhibit each other's effects at the receptor level. Let's get started with the top 10 most important ones. Both warfarin, a blood thinner, and NSAIDs, like ibuprofen, inhibit clot formation. When taken together, they significantly increase the risk of internal bleeding, leading to fatal hemorrhages. The normal INR range is 2 to 3. A high INR means a higher bleeding risk. Precaution: use acetaminophen instead of NSAIDs for pain relief in patients on warfarin. Beta blockers and calcium channel blockers both reduce heart rate and blood pressure. When combined, they can slow the heart excessively, leading to dizziness, fatigue, or even heart failure. An example of this interaction is metoprolol and verapamil. As a precaution, it's important to monitor heart rate and avoid this combination in patients with heart block. ACE inhibitors, such as lisinopril, reduce blood pressure but can increase potassium levels. When combined with potassium-sparing diuretics like spironolactone, potassium levels can rise dangerously, leading to cardiac arrhythmias. Normal potassium levels are between 3.5 and 5.0 milliequivalents per liter. Therefore, it's crucial to monitor potassium levels closely. SSRI antidepressants and MAO inhibitors both increase serotonin levels. When combined, they can cause excessive serotonin activity, leading to agitation, fever, tremors, and even death. The best example of this interaction is fluoxetine, an SSRI, and phenelzine, an MAOI. To avoid this, a washout period of at least 2 weeks is needed between switching these medications. Digoxin and loop diuretics, such as furosemide, can be a dangerous combination. Loop diuretics reduce potassium levels, which increases the toxicity of digoxin, a drug commonly used for heart failure. The main symptoms of digoxin toxicity include nausea, blurred vision, and arrhythmias. To prevent this, it is crucial to monitor potassium and digoxin levels closely. Combining benzodiazepines and opioids is particularly hazardous. Both drugs depress the central nervous system, and when used together, they can cause extreme sedation, coma, or even death. A common example of this dangerous combination is diazepam and morphine. The best precaution is to avoid this combination or use the lowest possible doses under strict medical supervision. The combination of aspirin and corticosteroids, such as prednisolone, can lead to severe gastrointestinal issues. Both drugs irritate the stomach lining, and together they significantly increase the risk of gastric ulcers and bleeding. To minimize these risks, it is advisable to use a proton pump inhibitor, like omeprazole, alongside this drug combination. Both drugs lower blood pressure. Taking them together can cause a sudden and life-threatening drop in blood pressure. The main and most important example is nitroglycerin plus sildenafil, also known as Viagra. Precaution: avoid using PDE5 inhibitors within 24 hours of taking nitrates. Both drugs prolong the QT interval, increasing the risk of deadly arrhythmias like torsades de pointe. An example is haloperidol plus ciprofloxacin. Precaution: avoid this combination in patients with heart disease. Metformin, a common diabetes drug, can cause life-threatening lactic acidosis when combined with contrast media used in CT scans. Precaution: stop metformin 48 hours before and after contrast administration. Thank you for watching. Understanding drug interactions can prevent life-threatening complications. If you found this video useful, hit the like button and share it with fellow pharmacists and medical students. Comment below which drug interactions you think are most important, and let us know which topic you'd like us to cover next. See you in the next video.